Dear friends and colleagues, a very good afternoon to all of you. The theme of this year's International Day of Yoga is Yoga for Humanity. In this occasion, we organized a presentation titled Women's Wellbeing and Yoga. For this presentation, we have Dr. Kanchan Chowdhury with us. Dr. Chowdhury did her graduation in Ayurvedic medicine from University of Calcutta and post-graduation from National Institute of Ayurveda, Jaipur. She did her doctoral research from Department of Social and Preventive Medicine and Yoga under the Faculty of Ayurveda of Banaras Hindu University. Prior to join as an assistant professor in this department, she was a senior resident. Dr. Jayant Nagar, a PG scholar of this department, will assist her for yoga demonstration. Over to you, Dr. Chowdhury.
Thank you, Renu madam. Thank you, Hashwati ma'am. A very good afternoon to all of you. Myself, Dr. Kanchan Chowdhury, Assistant Professor in the Department of Swasthavritta and Yoga, Faculty of Ayurveda, IMS PHU. Today, I am going to conduct a practical yoga session on women's well-being and yoga. So let's start. Nora Ephraim once said, above all, be the heroine of your life, not the victim. Women are competent, versatile, and successful, dynamic at work and doting at home. They are the glue that hold many pieces of life together. Any tribute will fall short of the place of women's hold in our hearts and societies. But women are also stressed while they look after everyone around them. Who looks after them? The answer lies in yoga, the balance that today's beauty with brains need. According to Dr. Nevin, yoga's incorporation in meditation and breathing can help to improve a person's mental well-being. Regular yoga practice creates mental clarity and calmness, increases body awareness, relieves chronic stress patterns, relaxes the mind, centers attention, and sharpens concentration. So, by not wasting time now, we begin our practical yoga session. And here, Dr. Jayant will demonstrate the whole yoga session for you. According to my title of today's lecture, there should be a female yoga demonstrator. But here I have chosen the opposite one because I am promoting this whole yoga session not only for female, but also for male, as it is beneficial for both. So let's start with some joint movements from toes to neck. Dr. Jayant, are you ready? Yes? Okay? Okay, Jayant.
Yes.
Firstly, place your hands on your hip joint for balance. Then extend your right leg forward without bending the knee joint. Then flex and extend your toes for 5 times. Very slowly, we have to done. Now repeat the same with left leg. Flexion and extension of your toes for 5 times. Now for ankle joint movement, flex and extend your both feet one by one for 5 times. Repeat the same with left leg. Now, rotate your knee joint clockwise and anti-clockwise for 5 times, keeping your feet attached together. 5 times clockwise and then 5 times anti-clockwise movement. Next, for hip joint movement, rotate the joint clockwise and anti-clockwise for 5 times. Now keep your hands straight and then do flexion and extension movements of your fingers for 5 times. Then for movement of wrist joints, do clockwise and anti-clockwise rotation of the same for 5 times. Now, straight your hands forward in supination. Palm will look at the sky. Now do flexion and extension of your elbows for 5 times. Then put your fingers on shoulder joint and rotate the joints clockwise and anti-clockwise for 5 times. Then for neck joint movement, do clockwise and anti-clockwise rotation of neck joint for 5 times. If you are suffering from any kind of cervical problem, do not practice the same. Very slowly, we have to do it. Here we have completed our joint movements. Let's do some yoga asanas. First of all, Tarasana. Stand with your feet slightly apart and make sure that your weight is balanced equally on both feet. Then inhale and raise your arms above your head. Interlock your fingers with palms facing upwards and stretch your whole body upwards by standing on toes. Relax your eyes and maintain a steady gaze forward. After some time, come back to the normal position and just relax. Tadasana improves posture, opens up the chest, and lengthens the spine. It gently strengthens the thighs, buttock, and leg muscles. It is beneficial in increasing awareness and concentration. It reduces flat feet and relieves sciatica. It releases tension and from our face. Contraindication of Tadasana: people who are suffering from low blood pressure and knock knee should avoid this asana. Relax, Tadasana. Then Trikonasana. First of all, stand straight. Separate your feet comfortably wide apart, about 2.5 to 3 feet. Then turn your right foot out 90 degrees and left foot in by 15 degrees. Now align the center of your right heel with the center of your arch of the left foot. Inhale deeply with hands outstretched, and as you exhale, bend your body to the left downwards from the hips, keeping the waist straight, allowing your right hand to come up in the air while your left hand comes down towards the floor. Keep both arms in straight line. Maintain the position for a while. Then with inhalation, come back in previous position. Repeat the same on the other side. Trikonasana strengthens the legs, knees, ankle, arms, and chest. It stretches and opens the hip, groin, hamstrings, shoulders, chest, and spine. It increases mental and physical equilibrium, improves digestion, and reduces anxiety, stress, back pain, and sciatica. Contraindications of Trikonasana: patient of migraine, diarrhea, high blood pressure, and neck and back injury should avoid this asana. Just relax. Next one is Padhastasana. Stand erect. Stand erect. Then bend your body forward with exhalation. Let the arms touch your floor. If it is difficult, take the arms only as far as it is possible without straining. Bring the trunk closer to the legs. Try to touch the knees with the forehead. This may require lots of flexibility. Hold the position for few seconds. After a few seconds, you come back. Padhastasana makes the body very flexible and it stretches the back and the leg muscles. It helps to eliminate excess belly fat and strengthen pelvic muscles. It improves digestion and reduces constipation. It makes the spine flexible and tones up the nerves. Repeat again, Dr. Jayant. Contraindication of Padhastasana: avoid this position if you are suffering from any kind of hip injury, backache, hypertension, or vertigo. Just relax. Next one is Ardha Chakrasana. This is the counter asana of Padhastasana. First, place your hands on back and then bend backward. When you are bending backward, it is important not to bend your knees. Try to breathe slowly while performing this asana and hold this position for a few seconds. Now, while exhaling, you need to come straight to your starting position. Relax. Once again, Dr. Jayant. Ardha Chakrasana is extremely effective to reduce thighs and belly fat. It improves lungs capacity, also helpful to control high blood sugar level and to stimulate the pancreas. It relieves back, shoulder and neck pain. It is helpful to reduce and relieve menstrual pain and disorders. Contraindications of Ardha Chakrasana. If you are pregnant, it is important to first consult your doctor and then perform this asana. People who are suffering from serious spine or hip problem or injury should not do this asana. And people with hernia and ulcer problem should not practice this asana. Next one is Vajrasana. Sit on a yoga mat for comfort. Step by step, Dr. Jayant. Step by step. First of all, you sit in Shikil Dandasana, then Sthir Dandasana. Then gently sit back on your legs, taking the weight of your knees. Sit erect with buttocks resting on your heels. Thighs of the both legs should rest on both the curves respectively, and the big toes of both of the feet should touch each other. Place your hands on your knees. Keep your back straight and look straight with your gaze forward. Head straight and chin parallel to the ground. Concentrate on your breathing as you slowly inhale and exhale. Try to remain in this position for a few minutes. Vajrasana enhances blood circulation in lower abdomen, improving digestion. It relieves excessive gas and pain in the stomach region, strengthens the nerves of legs and thighs. It makes knees and ankle joints flexible, preventing certain rheumatic diseases. It relaxes the waist and hip region, providing relief during menstrual pain. It also helps in relieving back pain. Contraindications of Vajrasana. Avoid performing Vajrasana if you are suffering from knee pain due to any underlying medical condition or have recently undergo knee surgery. Pregnant women can uh, perform Vajrasana, but they should keep more gap between their knees so as to avoid putting pressure on their abdomen. People with hernia and problems related to the intestine should perform Vajrasana only under the guidance of an expert yoga instructor. People with problems related to the back, like slip disc or disc prolapse, should avoid performing this asana. People with stiffness or any problem of the foot, ankle, or knees should avoid performing Vajrasana. Now open your asana. Relax. Please stand straight. We will do Malasana. Next one is Malasana. Stand straight. Separate your feet comfortably wide apart. Bend the knee and lower your buttock towards the floor to come into a squat. Malasana strengthens the feet, ankle, and legs. The pose also opens and strengthens the hip and groin. It is helpful for menstrual problem. It is a great pose to do when you find yourself in pain and uncomfortable condition. It opens up hips and releases discomfort. Contraindication of Malasan: if you have any lower back, hip, knee, foot, or ankle injury, either refrain from practicing this pose or consult with a expert yoga instructor. Just relax, Dr. Jayant. Sit properly. Then Titli Asana. Bend the knees, bringing your feet close to the pelvic region of the body. The sole of the feet must be pressing each other. Keep the heels as close as you can to the pelvis without applying force. Interlock your fingers and hold the feet firmly. You may also place the hands beneath the feet for a better grip. The outer edge of your feet must be firmly placed on the floor. Gently press the thighs in downward direction and try to hold for a few seconds. Release the thighs and start flapping them up and down without straining, similar to that of the wings of a butterfly. Do not put any force on the knees. Gradually increase the flapping. Continue this process for a minute or a count of 10 to 13 up and down movements. While flapping, the feet may move away from the body. Keep holding them back close to the pelvis. Practicing this asana give a good stretch to the groin, inner thigh, and knees. It enhances bowel and intestine movements. It is useful for pregnant women for a natural and healthy delivery of the child. It regulates irregular menstruation and helpful in getting relief from menstrual discomfort. It is beneficial for people who spend long hours walking and standing by providing relief in lower limbs. Contraindication of Titli Asana: if you're suffering from any knee or groin injury or sciatica or sacral conditions, then avoid this asana. Relax. Next one is Marjorie Asana. Sit in Vajrasan. Sit in Vajrasan. Then stand on the knees. Lean in the forward direction. Place the hands flat on the floor with palms down and fingers facing towards the forward direction. Keep the hands in a line with the knees. Keep the arms and thighs perpendicular to the floor. It is the starting position. Inhale a deep breath and raise the head along with putting stress on the spine in the downward direction so that the back can turn into a concave shape. Expand the abdomen as much as possible without forcing. Fill the lungs with maximum air possible. Hold the breath for a minimum of 3 seconds. Exhale and lower the head while stretching the spine in upward direction. Then contract the expanded abdomen and pull in the buttocks. Leave the head between the arms facing the thighs. Hold the breath for 3 seconds, stressing the arch of the spine and the contraction of the abdomen. Relax and practice again. Marjorie Asana is very good for the spine as it stretches the backbone and strengthens it while also improving its flexibility. This asana strengthens our wrist and shoulders. It also helps to tone up the abs by getting rid of excess fat from around hips. The asana also aids in digestion and increases metabolism. It is also beneficial for those aiming for height growth or an improved posture. For women, the asana can soothe menstrual cramps and stiffness. Contraindications of Marjorie asana, obviously pregnancy, and it should be avoided by those with knee, back, and neck pain. Just relax. Next one is Naukasana. First, lie down flat on your yoga mat with your feet together and your arms on the sides. Keep your arms straight and your fingers outstretched towards your toes. Start inhaling, and as you inhale, exhale, lift your chest and feet off the ground, stretching your arms towards your feet. Feel the tension in your stomach area as the abdominal muscles contract. Let the weight of your body rest entirely on the buttock. Make sure your eyes, finger, and toes all are in one line. Hold your breath and remain in this position for a few seconds. Now exhale slowly as you bring the body. Repeat again, Dr. Jain. Now exhale slowly as bring the body down to the starting position and just relax. You can perform 3 or 4 repetitions daily, but do not overdo it. Benefits of Naukasana. Naukasana strengthens the muscle of the abdomen, arms, thighs, and shoulder. It is really good and effective way of burning belly fat if practiced on a regular basis. It improves and regulates our digestion, including eliminating excessive gas and easing constipation. Most importantly, it acts as a distress tool, keeping your mind free and peaceful. Contraindications of Naukasana. Asthma and heart patients are advised not to practice Naukasana. If you have low blood pressure, severe headache, and migraine, you must avoid this asana. People suffering from chronic diseases or spinal disorder are advised not to practice this slow pose. Women should avoid it during pregnancy. Next one is Sarvangasana. You should start by lying down on your back with hands sideways close to your body and feet together. Slowly lift your legs back and butt together and support your back with your hands. Keep the elbows close to each other. Do not support your body with your head or neck. It should be supported by your upper arms and shoulder. Keep your legs straight and firm and bring the toes straight over your nose. Your entire body up to the shoulder should be in a straight line with arms supporting the back. Breathe normally and take care of your neck. Do not press it on the floor. Maintain the position. Bring with 10 seconds and take deep breath. If you start feeling the strain, bring down your knees to the forehand and lower your legs slowly with the support of your hand. Take a deep breath and relax a minute to breathe normally. Once again, Dr. Jayant. Sarvangasana enhances the flexibility of the spine, improves the lungs capacity. Toxins from the respiratory system are drained by it, resulting in more oxygen supply to the organs. It relieves symptoms of menopause and balances the mood swings in women. It is found to be beneficial in conditions like syphilis and frequent abortions. It stimulates the thyroid gland and regulates both low and high thyroid hormones. It promotes good sleep at night, and it also releases happy hormones like dopamine, which results in relieving stress, anxiety, and depression. It also helpful in treating insomnia and mood disorders. Contraindication of Sarvangasana: diarrhea, headache, high blood pressure, menstruation, neck injury, and pregnancy conditions. Just relax, Dr. Jayant. Now, Bhujangasana. We will do Bhujangasana. Lie on your belly with the chin on the floor, palms flat on the floor under the shoulders and legs together. Pull up the kneecaps, squeeze the thighs and buttocks, engage mulbandh and press the pubic bone down into the floor. Without using the arms, inhale and lift your head and chest off the floor, keeping the neck width in line with the spine. With the elbows close to your sides, press down into palms and use the arms to lift your up even higher. Drop the shoulder down and back and press the chest forward. Keep the legs, buttock and mulbandh strong and keep the pubic bone pressing down into the floor. Breathe and hold for 2 to 6 breaths. To release, exhale and slowly lower the chest and head to the floor. Just relax. Once again, Dr. Jayant. Bhujangasana opens up the shoulders and neck to relieve pain. It tones up the abdomen. It strengthens the entire back and shoulders. It also improves flexibility of upper and middle back. It expands the chest. Reduces fatigue and stress. It is useful for people with respiratory disorder such as asthma, etc. Contraindications of Bhujangasana: people suffering from hernia, back injury, headache, and recent abdominal surgeries should not perform this asana. Pregnant women should not perform this asana also. Next one is Shalabhasana. Lie down flat on your abdomen. Place your hands beneath your thighs. Rest your head on your chin. That is, your face must not on the floor. Breathe deeply or a while. Inhale and raise your legs as high as you can. Make sure your knees remain straight as your legs are lifted. Maintain the posture for about 5 seconds at the outset. With practice, increase the time to about 30 seconds. Then exhale your lower leg gradually onto the floor and just relax. You can do this asana by one leg and then another leg, and after that, both legs. Shalabhasana strengthens our leg, pelvic, arm, shoulder, thighs, calf muscles, and hip and back muscles. It encourages good posture and a slim figure. It is beneficial for depression. It is one of the best asanas for PCOD, polycystic ovarian disease. Contraindications: This pose must be avoided by women during pregnancy and menstruation. Cardiac patient or people with high blood pressure must also skip this asana. Do not try this asana if you are suffering from hernia. People with travel back or sleep disc must not practice this pose. Just relax. Now we will go for Shavasana. Dr. Jayant. Now let us prepare for Shavasana. Lie down over your back. Maintain a distance of 1 feet in between your legs. Keep your hands away from your body and palms should look at the sky. Close your eyes and concentrate on your breathing. Now deep inhale and deep exhale. Deep inhale and deep exhale. Relax. Relax. When you take up deep breathing, then think that all the positive energies enters inside your body, and when you exhale deeply, all the negativities from your body comes out. Relax. Relax. So deep inhale and deep exhale. Now we will relax all our joints one by one. First of all, concentrate on your toes and then just relax your toes. Relax. Relax. Then concentrate on your ankle joints and also relax them. Relax. Relax. After that, concentrate on your knees or your knee joints and also relax them. Relax your knee joints. Relax. Relax. Then after that, relax your hip joints. Relax. Relax. Then concentrate on your fingers and just relax them. Relax. Relax. After that, relax your wrist joints. Relax. Relax. Then concentrate on your elbows and just relax them. Relax. Relax. After that, relax your shoulder joints. Relax. Relax. Then concentrate on your neck joint and just relax, relax, relax. After that, relax your all the muscles of your body. Relax, relax. Now all the joints of your body has relaxed. We are feeling calm and rejuvenated. All your discomforts or travels are going out from your body. Just relax. Just relax. Now concentrate in between your eyebrows and focus on your God or spiritual guru and just talk to him, then pray to him that you and your family will be happy for all the time. Relax, relax. Then concentrate on your God for a few times. Do not open your eyes and just relax. Relax, relax. Now refocus on your mind from your God towards the outer world. Then turn over your left side. Then turn over your left side and gradually wake up and sit down. Then rub your palms and put them on your eyes, but not forcefully. And with a prayer, complete your relaxation. Now it's time for pranayam. First of all, we start with Nadi Shodhan pranayam or Anulom Vilom pranayam. First of all, sit in any dhyanasan like Padmasan, Siddhasan, or Vajrasan, or you can sit in Sukhasan with erect spine. Then bend your right hand at elbow and perform Nashikagra Mudra by bending the index and middle finger and bring the ring finger, little finger near to the thumb. Touch your right nostril by thumb and left nostril with the ring finger and little finger. Close the left nostril and inhale deeply. Sorry, close your left nostril and inhale deeply through right nostril and fill the lungs completely by the air. Then exhale through the left nostril by closing the right nostril. Then inhale deeply through the left nostril by closing the right nostril. Exhale deeply by the right nostril. This is the one cycle. We can repeat the cycle for 5 to 10 times. Benefits of Narishodhan Pranayam. One feels refreshed as there is excess of oxygen supply after doing this pranayam. Nerves are calmed and purified. Mind becomes still and relaxed. Just relax. The next one is Brahmari Pranayam. Sit in any Dhyanasan or Sukhasan with erect posture. Close your eyes and looks inwards. Perform Shadmukhi Mudra by closing your ears by thumb and put your index finger on your eyes on your eyelids and middle finger on your neck bone, ring finger on your upper lips and little finger on under the lower lips. Just slightly press the your face. Take a slow, deep, and steady breath through the both nostril. Fill the lungs completely. Then exhale slowly with humming sound like a black bee. Repeat the cycle for 5 times. The sound is like this. Hmm. With exhalation, we have to do this humming sound. Mm, It is beneficial for insomnia, releases stress, tension, anxiety. It improves our voice and throat elements. It is also beneficial for the singers. Now, just relax, Dr. Jayant. Next one is Omkar Dhyan. Sit in any Dhyanasan or Sukhasan with erect position. Close your eyes. Perform Gyan Mudra by your both hands and place the hands on your knees. Then close your eyes and we chant uh, the Om word for 3 times. Dr. Jain, yourself. Unmute yourself. Sorry. Dr. Jain, unmute yourself. Take a slow, deep, steady breath through both nostrils. Fill the lungs completely and exhale slowly. After that, with inhalation, we will chant Omkar sound. After that, concentrate for a few minutes. Just relax yourself. We can perform this Omkar Dhyan for 5 to 10 minutes or as you can. But due to shortage of time, I'm just mm, stop Dr. Jayant to do this Omkar Dhyan. Now we will complete the session with Shanti Mantra. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः Thank you, Dr. Jayant.
Thank you, ma'am.
I am very thankful to the whole team of Center of Women's Development Studies, New Delhi, and special thanks to Assistant Director Ma'am, Mr. Renu Adlakha and Mrs. Bhasuti Thakurta for giving me this wonderful opportunity to express my views in front of you in this National Yoga Day. I am very thankful. Thankful, ma'am. Thank you, ma'am.
Thank you, Dr. Kanchan Chowdhury. Now we are in the question answer session. Like if you have any question to Dr. Chowdhury, please, you can ask any question regarding yogasana and mudras.
Bhashwati, I have a question.
Yes, please.
I want to ask, when you do the inhalation and exhalation, is it because, all of us are kind of amateurs in yoga, but there are various versions that when you do inhalation and exhalation, you should do the inhalation through the nose and the exhalation through the mouth in some instructions that is there. But I want clarity on that in the, in the practice of yoga. Is inhalation and exhalation both to be done through the nostrils?
Yeah, ma'am. Both should done with the nostril, not by the mouth.
Okay.
And it is very important, ma'am, because if you backward, अगर आपको backward bending करना है, तो अगर आप exhale करते हुए, if you exhale करते हुए अगर जाते हैं, तो आप comfortable नहीं हैं. और जब आप inhale करते हुए जाते हैं forward bending में, तब भी आप comfortable नहीं हैं. तो ये जो postures हम करते हैं, तो जब भी हमें आसन करना होता है, तो हमें एक कंफर्टेबल मोड में होना होता है. ठीक है. तो कंफर्टेबल मोड में होने के लिए हमें इनहेलेशन एक्सहेलेशन प्रॉपर्ली होता है. अगर आपको फॉरवर्ड बेंडिंग करना है, आप विद इनहेलेशन करोगे, आप कभी नहीं कर पाओगे. यू कांट नेवर डू with a smiley face or with a relaxed mode. That's why inhalation and exhalation is very important.
ठीक है. No, I mean, I think it was very, जो आपने presentation किया बहुत logical था कि आपने शुरू किया joints को, एक joints को stretch करने में, और जब आपने फिर जो asanas complete किया शवासन में, तो आपने relaxation mode फिर भी वही sequence joints का किया from toes to neck. तो वो मेरे को काफी लॉजिकल लगा.
Thank you, ma'am.
I will also ask. In fact, I will. I mean, all of us, all of us try to do a little bit of yoga in our life. So I will definitely look at what you have done in detail and try to practice what Dr. Jain has done, because I can see its utility for our lives.
Any more questions?
Okay, I think there are no more questions. I think I'll ask Sundaresh to, even if people are not interested, I'll ask Sundaresh to mail the recording of this to everybody. So everybody has it, and in their own private time, they can try, if they can do it if they want to.
That's not as definitely.
So, yeah.
Yeah, thank you, Dr. Kanchan Chowdhury. Thanks a lot for your presentation in our in this day of International Day of Yoga. And at the same time, thank you so much, Dr. Jayant Nagar, for your demonstration. We are really this combination of demonstration and at the same time the actual how to do this demonstration, this combination really helps us to understand the mode of yoga and how to do it. And this systematic presentation really helpful for us. And I'm so much thankful from both of you. So thanks a lot. Yeah.
And thanks for keeping it simple, like for beginners, not too complicated. So people will be encouraged to actually take it up in their lives. Thank you so much. And please do remain.
Thank you so much.
And please do remain in touch with us. And if we are in Banaras, we will definitely come and look you up.
Yeah, sure.
You and Dr. Jain.
Jain.
Yes.
Sure,
thank you.
Sure.
Thank you so much.
Thank you.
Goodbye.
Goodbye.